12 popular medications that can trigger rapid dementia. Every about 1 minute, another person in United States of America will be told that he or she have dementia. And surprising, the cause for dementia was never their age. The cause is drug on your shelf or on ethical cabinet. According to recent researches, check if any one of theses. Number 1 is diphenhydramine. Benadryl is called phenyramine and Phenergan. Benadryl belongs to a group of drugs called anticholinergics. They block a brain chemical called acetylcholine. By blocking acetylcholine receptors, it disrupts cholinergic neurotransmission, which is essential for memory and learning, leading to confusion and increased long-term dementia risk. Number 2 is one your stomach loves so much. Number 2 is the proton pump inhibitors. The big names are omeprazole, sold as Prilosec or Gasec, and esomeprazole, sold as Nexium, and pantoprazole as Pantazole. People stay on them for years, sometimes decades. PPIs have also been shown to raise levels of amyloid beta in the brain, the sticky protein that builds up in Alzheimer's disease. So here is the action to do. If you take a PPI every single day, that is the conversation to have with your doctor. Many people can taper down or change to gentler class, less likely to touch your thinking, or adjustment to proper dosage or giving alternative drugs. Number 3 is the bladder drugs, is oxybutynin, sold as Ditropan. It works by blocking acetylcholine. Their risk of dementia was 49% higher, close to 1 in 2. And here is what troubles me most. Almost none of them were warned. They were told a pill would calm the bladder. Nobody mentioned it might be dimming the mind at the same time. If you take oxybutynin and you have noticed your memory down, take that seriously because you do not have to choose between your bladder and your brain. There is newer alternative drugs like mirabegron, sold as Myrbetriq, work through a completely different pathway and do not block acetylcholine at all. For most older adults, they give the same control with far less risk to thinking. Number 4 might be the most surprising one here, because it is one of the most prescribed drugs on earth. Number 6 is statins. Simvastatin and atorvastatin, sold as Zocor and Lipitor, are among the most prescribed medicines in the world, especially after 60, and they do an important job lowering cholesterol and to decrease risk of heart attacks and strokes. Cholesterol does far more than affect your heart. Your brain is close to 60% fat, and it uses cholesterol to build the myelin sheath and nerves so signals travel fast and clean. Lower cholesterol hard enough, with a strong enough statin, and you can leave the brain short of a raw material it actually needs. The statins that cause the most trouble are the ones that cross easily into brain tissue. In 2023, a study in Frontiers in Aging Neuroscience found that adults over 70 who had been on statins for more than 3 years had a 26% higher rate of mild cognitive impairment, and the higher the dose, the steeper the slide. The important thing to understand is that not every statin touches the brain the same way. Pravastatin and rosuvastatin do not cross into brain tissue as readily and are generally considered the safer choices for thinking. So if you have been on a statin for years and you are noticing brain fog, forgetfulness, or confusion creeping in, that is a real conversation to have with your doctor about a lower dose or a switch. It is not a reason to quietly quit a drug that may be protecting your heart. Get the plan right with help, never on your own. And discuss with cardiologist and neurologist. And kindly tell me how many prescriptions you are taking right now. Number 5 is the benzodiazepines, lorazepam sold as Ativan, diazepam sold as Valium, alprazolam sold as Xanax. These are among the most prescribed drugs in America for anxiety and for sleep, and they work by boosting GABA, the brain's own calming signal that turns down overstimulated nervous system. At first they feel like a rescue. The panic improved, the spinning thoughts stop, sleep finally comes. Over time the picture changes. A 2022 study in the British Medical Journal followed more than 8,000 seniors for 6 years and found that those who used benzodiazepines for longer than 3 months had a 51% higher risk of Alzheimer's disease. The longer-acting ones like diazepam were worse because they build up in fatty tissue, including the brain. You must know. Stop a benzodiazepine abruptly, and the anxiety and insomnia come back twice as hard, along with agitation that can be genuinely dangerous, which makes the pill feel essential right when it is doing the most harm. So here is the rule, and it matters. If you have been on a benzodiazepine for more than a few weeks, do not stop suddenly, because that can be life-threatening. Work with a doctor to taper down slowly over weeks or months. Another options exist, like buspirone for anxiety, which does not sedate or cloud the mind. Number 4 is a single pill prescribed for 3 different problems, and it carries one of the heaviest hidden burdens of all. Number 6 is amitriptyline, sold as Elavil. It is an older antidepressant that is still handed out today for nerve pain, for sleep, even to migraines. It looks like a do-everything pill. It is one of the most powerful anticholinergic drugs still in wide use, the very chemical your neurons need to talk to each other and lock in new memories. It blocks it so strongly that with long-term use, memory loss becomes the expected result. In 2015, a large study in JAMA Internal Medicine followed more than 3,400 adults aged 65 and up. Those with the highest cumulative dose of anticholinergic drugs, like amitriptyline, over 10 years, had a 54% greater chance of dementia. And almost none of them were ever told the pill could do that. They got it for sleep or for pain, then slowly noticed words going missing. Memory affection, a small nightly dose, taken for years, can quietly erode brain power with no obvious symptom until the loss is real. If you or someone you love takes amitriptyline, that is a conversation worth having soon. For nerve pain, options like duloxetine or gabapentin can give similar relief without the same anticholinergic weight. For sleep, melatonin or a very low dose of doxepin, which is far gentler on this chemical, can take its place. 7. Topiramate, Topamax. Popularity and use. Moderate to high, widely used for epilepsy, migraine prevention, and off-label for weight loss. Mechanism. Enhances GABA activity and blocks glutamate receptors, known to cause dose-dependent cognitive dysfunction, particularly in language and working memory, mimicking dementia. Studies done. Clinical evidence confirms that topiramate causes cognitive impairment more frequently than other antiepileptics, with deficits emerging in a dose-dependent manner. Number 8 is tramadol. High popularity and use mechanism. Weak mu-opioid receptor agonist and serotonin/norepinephrine reuptake inhibitor. Chronic use can cause neuroinflammation, disrupt sleep architecture, and lead to recurrent delirium, which accelerates dementia. Studies done. A 2024 study in the American Journal of Geriatric Psychiatry found that regular opioid use for chronic pain is associated with an increased risk of incident dementia. JAMAnetwork.com. Number 9 9-cimetidine, Tagamet. Mechanism. Crosses the blood-brain barrier and acts as a weak anticholinergic and NMDA receptor antagonist, frequently causing confusion and memory issues in the elderly. Studies done. Numerous case reports and studies demonstrate that cimetidine is capable of causing significant cognitive toxicity and reversible drug-induced dementia in older adults. Number 10 is paroxetine, sold as Paxil. It is one of the most prescribed of a family of antidepressants called SSRIs, used for depression and anxiety, and on the surface it looks like the modern. Paroxetine is the one SSRI with strong anticholinergic activity. In 2021, a large review in Frontiers in Psychiatry looked at older adults on different serotonin selective reuptake inhibitors and found that paroxetine users showed measurable drops in short-term memory, word recall, and attention within the first 12 months. Seniors on paroxetine were 30% more likely to show early signs of cognitive impairment than those on other antidepressants. If you take it, ask your doctor about moving to a safer SSRI like sertraline or escitalopram, which are gentler and do not carry the same cognitive risk. Supporting your B vitamins, especially B12 and B6, can help steady mood naturally alongside that change. Number 11. The names are quetiapine, sold as Seroquel, risperidone, sold as Risperdal, and olanzapine, sold as Zyprexa. They were built and approved for serious psychiatric illness like schizophrenia and bipolar disorder. Today, they get handed out off-label to older adults for sleep, for mild restlessness, for the agitation that can come with dementia itself. Powerful drugs meant for severe illness, now used in homes and nursing facilities on seniors who are simply confused, restless, or hard for a busy staff to manage. In 2022, a study in Lancet Healthy Longevity followed more than 25,000 older adults and found that those given antipsychotics for behavioral symptoms were 71% more likely to suffer worsening cognitive decline within a year, even with no history of dementia before they started. These same drugs also raise the risk of stroke, of sudden cardiac death, and of the heavy sedation that leads to falls and hospital stays. They work by suppressing dopamine, a chemical tied not only to mood, but to focus, planning, and memory. Drop dopamine far enough, and the brain goes slow and unresponsive, which is why people on these drugs can seem dull, flat, almost absent. If you or a loved one is on one of these, the first move is to ask the prescribing doctor a direct question. Why was this started, and is it truly necessary? And when medication really is needed, the lowest dose for the shortest time keeps the harm down. Far too often, no one ever tells the family what these drugs do to the brain, and they watch a decline they believe is aging when the cause is chemical. Number 12. Prednisone and other systemic corticosteroids. Mechanism: chronic, high-dose use can lead to hippocampal atrophy, the brain's primary memory center, due to glucocorticoid-induced neurotoxicity. This results in measurable memory impairment and cognitive decline that may partially reverse upon discontinuation.